Going to the dentist is important to keep our teeth and gums healthy, yet some people stay away from the dentist and they compromise their oral health because they're simply anxious or stressed about dental procedures. But what if you could be sedated during your dental exam and maybe not even remember a thing when it's over? Joining me now from Stonecreek Dental is Dr. Clark Sanders and Dr. Aaron Bealey. Nice to have both of you here.
Thank you for having me.
Is this really true, Dr. Clark, that you can almost sleep through an appointment?
Me personally or the patient?
Yeah, we're hoping it's the patient and not you.
It's definitely the patient. Yeah, we've done almost 1,700 sedations, and it is probably one of the most fun things we do because the patient, we get to do more dentistry, they get to be happy, they don't remember. It's just a very pleasant way of having dentistry done because a lot of people in this country, they don't like us.
Don't take it personally. Okay, good. Well, Aaron, what is the process? How does this work?
We do our sedation using just a small pill. So we have patients that take a pill the night before, a pill that morning. You need someone that can drive you and pick you up that day. But their first visit here, we have them in, we lay them in a comfortable chair, we put a nice warm blanket on them, we put headphones on them, and we give them more medicine until they get very, very comfortable and relaxed. And we can do as much dentistry as they would desire in that one morning while they're very relaxed.
So, Clark, who would you say that this is probably good for? What type of patient? Obviously someone who can be very anxious about going to the dentist.
Probably anybody with teeth or without teeth. Pretty much as everyone.
He's got his own show later, people.
Yeah. Good. It's just for the person that has a lack of time. Mm-hmm. It's not just all about anxiety. Sometimes it's a guy that's a busy, or a gal that's a busy business person that said, I can't do this.
So you can do a bunch of things at one time?
Yeah, we can do more in one visit. So that's the person. A gagger, somebody that doesn't numb well, you know the person that says, I never numb. You can't get me numb. I said, well, we got something else that we can do. So, and obviously the anxiety person. And there's a lot of them. I mean, there's a lot of people in this world that are like that. So
does this involve needles at all? It's all strictly oral medication.
Oral medication.
Okay.
Yeah.
So
we
people who are
certified.
You are IV certified, but for people who are afraid of needles too, there's just do they not really remember it, Aaron, when it's done?
Most patients remember very little, if anything, of being there. A lot of times they'll go home and they'll take a really good nap that afternoon, and they'll wake up and they'll think that they missed their appointment. And then they'll look in the mirror and see that their teeth are all beautiful and everything's been done.
How much easier, Clark, is it for you then as a dentist to work on folks who really are just much more laid back and let you do the work that needs to be done?
Because they're not anxious and they're moving around, which then makes us anxious. Mm-hmm. The patients, kind of bouncing around and that it's so much easier to have them just kind of very, very relaxed, and it's more comfortable to us. And I really think we always do a great job, but it's easier to get the great job done.
And can anyone do this, Aaron? Are there any chronic illnesses or things like that might prevent someone from really being a patient?
Normally we will do it for people ages 18 and over. Mm-hmm. There's very little medical issues that may limit what we do. We might just alter the medications that we use, but for the most part it works for everybody.
And the other question, Clark, is will it just work for folks who need a filling, or is this only really reserved for people who need something more in-depth, like a root canal or gum surgery?
Right. Those are great questions. We've done it for as little as one filling.
Yeah.
The person just says, I can't do this.
Mm-hmm.
I said, well, okay, let's do it this way, and it makes it for a more pleasant visit.
So what's the patient's reaction when they've done this for the first time?
Where was I?
Yeah. They love it.
It is. It really is true. They get home and I've had people call and say, I'm sorry I missed my appointment. You didn't.
You were here in the chair. Trust me, you were here. Yeah, that has to be a relief for some of these folks, Aaron. And do you really see people that maybe have not gone to the dentist in years because of this anxiousness?
Absolutely. And they just wish that they had known about this sooner, and they wish that they had come to us sooner, and they will never do dentistry any other way ever again.
Well, you are here spreading the word, and we have your phone number, and we've got your website up there so that folks who really do need what you offer can contact you. It's very interesting. Thank you so much for joining us.
I think also because this is the Gail Hogan Show, we'd like to have people that, our sedation is usually $380. We would like to offer them a half off sedation and free exam and x-rays, because most people don't want to pay to find out what's wrong. They want to pay to fix it. So we'd like to offer that to everybody that knows you.
Great. Thank you so much. That's wonderful.